Hey guys, welcome back to my channel. As you guys know, my name is Abigail. I'm no longer a Broward College nursing student, but I'm a nursing graduate of Broward College. So today I'm here to discuss, about how do we give our professors report as students. So as you guys see on my iPad, I have my little stuff that I make. It's pretty blank right now, so I'm gonna just give you guys a little scenario of what we do, and not just for nursing student but also for nurses, because I notice a lot of nurses don't know how to give a good report. And it's like, it's so much that you don't even help me out, so I want to explain like how I do it. And this is report that I've learned since like process. I keep adding and adding and adding and adding to it. However, as you guys know, I was a nurse extern, so my nurses, they taught me a lot. They were also a Broward College student, and they do instill on, they're very like strict on, you need to give a report on this patient and stuff like that. So they've really trained me well. So I just want to share my knowledge, and someone share their knowledge with me. I just want to share my knowledge with y'all. So first, like you're given, let's do a professor rundown. So my professor came, she gave me 3 patients. What am I gonna say? So this is how I would do it. I'm not saying it's the correct way to do it. I'm not saying I know how to do it, but I've never really been giving report from I have this format. At the end, I will tell you guys how I played it out, or how I set it up, and hopefully it will be of help to someone. So as I say, it's blank. You can see it's my bad handwriting, stuff like that. So the first thing I want to say is patient A in room 221. She is 69 years old. She's oriented ×3. She is a DNR. She came in because she has abdominal pain. However, she was diagnosed with pancreatic lesion. She's allergic to tomato and strawberry. Her IV is in her right AC. It's number 20. And she's currently on a diabetic diet, or she's currently NPO. Let's just say she's NPO. The patient has a history of CKD, hypertension, and diabetes mellitus. The admitting doctor was Dr. ABC. However, the consulting doctor is Dr. BDE. I move forward to say that radiology, I talk about radiology. So the patient did a abdominal CT on the chest. The lungs were all clear. She did an abdominal CT also on the abdomen, which shows the pancreatic lesion, which is 5 centimeters, and it was located in the head of the pancreas, or the tail of the pancreas, or the body of the pancreas. I go forward and I talk about my labs. I would say, okay, labs that are abnormal was the creatinine. And the creatinine and the potassium was elevated, and the BUN was also high. So I basically talk about my abnormal labs. I have every labs written down, because based on the medication that I'm gonna give, I need to have my labs written down so that I could go back and look. So I then move forward and I talk about my assessment. The first assessment I want to talk, I already said that she was orientated. So, okay, she's cognitive. So the first assessment I want to talk about, my patient came in because of abdominal pain. So I'm going to talk about my GI first. This is what I do. I'm not saying it's the right way to do it, but this is what I do. I'm going to talk about my GI first. And I'm going to say, okay, she bowel sounds are hyper normal active. Her last bowel movement was this morning. I go to the heart. And I talk about S1, S2 is regular. She's on a cardiac monitor for the potassium, and is showing normal sinus rhythm. The patient blood pressure was a bit elevated, but I did check, and when I realized, it's been constant constantly high. The patient O2 is this, the temperature is this, the skin is negative, meaning there is no, you know, wounds or anything like that. I go back and you know, I talk about my lung sound, they're clear, there's no crackles. However, as you see on my little thing right here, I have other, right? For the other, this is where I put this. The patient has a PICC line. Is the patient has a chest tube? What does the patient has extra that I think you should know? So I'm gonna say, okay, the patient has a PICC line in the left arm, and there the patient does has an allergy band, and the patient does has a restricted armband on their hand. Whatever labs that are abnormal, that's what we're gonna mention. Consult, what am I gonna do for the day? Who am I gonna consult with? What am I gonna do for this patient? How am I gonna take care of this patient for today? So okay, I for today, what I'm gonna do for my patient is, you know, make sure she's comfortable, not really having a lot of pain. I'm gonna try to be on schedule with that pain medication. The patient is supposed to go down for a procedure. I'm gonna make sure I do the pre-op check. I'm gonna make sure I clean the patient with the antimicrobial wipes for the patient to go ahead and get that procedure done. I'm gonna make sure the patient, there is nothing around surrounding the patient like food or anything like that, so that she could accidentally eat. What else I'm gonna do for this patient? With the patient medication, I do see that the patient has Luvenox, so I'm not gonna give Luvenox because Luvenox is being excreted by the kidney, and you know, if the patient kidney level is already high, I'm not gonna do it. The patient has dialysis, so the patient will be going, the patient has that, in other, I would normally put dialysis, that the patient has dialysis Monday, Wednesday, and Friday. Hold the medication, you know, lisinopril, because the potassium is elevated, and what lisinopril does, lisinopril elevate the potassium. So it's like, you know, I'm gonna explain my whys as I go along in explaining my plan for the day. I'm gonna go ahead and I'm gonna call, since today is Tuesday, dialysis is Wednesday, I'm gonna call the doctor and see if I could get the blood pressure medication changed, because the medication was, the blood pressure was high, you know. Now it's different when you're giving it to a nurse, because when you're giving it to your professor, it's like you're gonna say the room, you're gonna say the name, blah blah blah. But when you're giving it to a nurse, you're gonna be in the room with that patient, so you're gonna go, you introduce yourself, you're gonna be like, hi, this is nurse Daniela, she'll be taking over from me, you know, and I'm gonna give her a brief rundown on what's going on with you. So I'm gonna go back, do the same thing, my patient name, the patient chief complaint, the diagnosis, the age, the code, the allergy, the IV gauge, the history, the radiology. So for me, it's gonna be like, I'm gonna go ahead and slow down and repeat all of those for you guys, so you guys can write it down in order. So okay, patient, she's 89 years old, she is DNR, she has allergies to tomato and strawberry, she has IV in the right AC, she also has a PICC line in the left arm. She's currently NPO. She has a history of diabetes, CKD, hypertension. This is what's being found when the radiology is done. This is what's being found: 5 centimeter of pancreatic lesion in the head, the tail, or whatever, wherever it is. I'm gonna say, you know, in the beginning when I'm talking about the patient, I'm gonna make the nurse know that she's oriented. I'm gonna come down to my assessment. I'm gonna talk about, you know, it's GI, it's abdominal problems. So I'm gonna talk about the patient bowel movement, the heart, the respiration, or how the blood pressure is looking. It's elevated, the temperature, the bowel movement, you know, every other thing that is there, dialysis Monday, Wednesday, and Friday. You know, what medication did I hold today? Why did I hold those medications? So I hold lisinopril because the potassium was elevated. I hold and I replaced the lisinopril with hydralazine. I hold Luvenox because the patient creatinine level is too high. I don't feel like I have to explain why to the nurse, Like I hold it because I just need to say I hold it because the potassium is too high. I don't think I need to tell a nurse that the kidney excrete Luvenox, so because the creatinine was high, I didn't give Luvenox. No, that's what I need to tell my professor, to let them know I know what I'm doing, I know what I'm saying. But I don't feel like I need to tell that to a nurse. Like, I feel like you should know that, you know. I could be wrong, but I feel like you should know that. So then I'll talk about medications that I hold, what I did for the patient. How was the patient today? Was the patient agitated? Was the patient relaxed? Like, what's going on, you know, with the patient? What had made the patient agitated? Is it because the patient was in a lot of pain? What's really going on with that patient? So that's just it for the report. And it's like less than 12 minutes, and I gave 2 different kind of report. So you know, you want to try to give your professor all the information you think they'll ask you for, so that they don't have to be drilling you. And oh, one more thing before I forget, know when you're giving your plan of care, if it's a pending discharge, you need to say who the patient lives at home with or who the patient is going home with. Because you can't just get up and be like, oh, I don't know. You need to know, does the patient have help? Because you need to know if you need to go to if you need to collaborate or consult with social services. Like, you know, the patient lives by himself, he won't be able to change his dressing, or, you know, I think the patient gonna need home health aid, or, you know, but you know, you need to pretty much be able to explain to your professor, why does this patient has a PICC line? Oh, because, you know, the patient has cellulitis or a bone infection, osteomyelitis or something, so this is why they have the PICC line. In the date the PICC line was in the date of the IV was inserted. Did it change since the patient got here? Those are the stuff you need to tell your professor. So let me give you guys an order of how I say it, and you know, I hope this really helps someone. And you know, because someone taught me, so you know me, if somebody taught me, I want to teach somebody else. So first, you want to write down for your professor, you want to write down the room the patient is in, the patient's name, the patient's age, what is the patient code, what is the chief complaint and what were they diagnosed with, the patient allergies, what IV gauge or what line the patient has in, and the patient diet. You're gonna go down, you're gonna talk about the patient history, radiology, labs. Talk about the patient labs. You're gonna go ahead and you're gonna tell your professor the patient assessment. What other information pertaining to the patient do you think is important? Does the patient live at home with his brother? Is his wife? Does this patient the patient live with his brother? Does the patient live alone? The patient is married. Does, you know, like, who's there to support this patient? Talk about the PICC line, talk about the dialysis, talk about everything other is extra information that you want to speak on in regards to your patient. Then you're gonna go ahead and you're gonna do the day schedule for the patient. What am I planning to do for this patient for today? If it's another nurse you're giving pass down to, remember to say, what did I do for this patient today, you know, and you will be good. So I did fulfill my my promise that I would give a report, how to give a report and how I do it. As I said, it does not necessarily have to be the right way I'm doing it, but I've never been dinged on it, or nobody have never had to question me further on it. So it's like, or none of my professors have to you know, be like digging me. My friends would say you give too much information, but I prefer to give too much than you asking me and I'm getting nervous and I'm not remembering what to say, because that's a problem. When I get nervous, I don't be knowing what to say. So I feel like this is a great way, and I hope someone learned from it. And you know, stay tuned. Remember to like, subscribe, and share with y'all friends. And thank y'all for the love and for the support. I'll give you guys more about graduation, all that stuff. Right now I just need to go in, sleep, so I could burn the midnight light to study for this NCLEX. Y'all pray for me while I pray for myself in Jesus' name. But you know what? When Jesus say yes, nobody can say no. That's it right there.